You are watching the DocTalk show.
So welcome back. We are discussing a type of cancer that affects so many Ugandan women. Unfortunately, causes so many deaths in the Ugandan women population, yet is a very preventable disease. That is cervical cancer. We are going to understand how one can identify or tell whether they could be having cervical cancer by virtue of the signs or symptoms, and how best one can prevent themselves from getting this type of cancer. So, Dr. Mugisha, when someone acquires this infection, what exactly happens? Is it like immediately guaranteed they are going to get this cervical cancer?
So thank you.
What you help us understand, is it true that everyone who gets this virus will get cervical cancer?
So it is a very gentle and its onset is over a very long protracted period of time. It is projected that from the time you actually acquire this virus from, say, contact with somebody with, it probably lasts about 8 to 10 years for you to start seeing changes and actually develop a cancer. So we do feel that it gives us ample time within which we can actually screen and look for these cervical changes. Dr. Musingzi alluded to when the virus actually, when you get the virus, many women clear it. Cumulatively, I told you over 80% of girls and women do actually acquire this HPV. As long as they are sexually active, it is hard. They will actually acquire it. Majority of whom clear. Majority of whom will get it and clear, like many other illness. But there is that portion that it remains persistent. If your immune system is low, you probably have other chronic diseases, maybe diabetes, HIV sets in, you're on certain drugs which reduce your immune system, you're malnourished for some reasons. Then this virus flourishes because now you're not fighting it. So it is that persistent, the persistent infection that you actually have that later predisposes you to cervical changes.
So it isn't true that every woman who gets this infection will get cervical cancer.
No.
It's just the women in whom the infection persists.
Yes.
Okay, when you suggest that the reasons are related to the immune system.
Yeah.
When we talk about immune system, these are like your body's defense against infections. So if for some reason the body's defense is not able to clear this infection, in this case HPV, if it persists, it will result into the cancer. But you mentioned that time period. Well, what did you mean by that time period?
Yeah, the time period of about 8 to 10 years. It's very generous. So we don't usually see this cancer in 20-year-olds. We think you've started being sexually active maybe 10 years. So you see, it gives us a lot of time for changes to actually develop and you have cancer. So there are changes that happen that are not necessarily cancerous, but they are leading to. And when we talk of screening, we hope we can pick some of those cervical changes. So cells there start to change, blood supply changes, appearance of these cells changes. And when you do frequent screening, we can actually pick these changes and say, you're probably headed there, but we can actually stop this cancer at this stage before we actually head there.
Okay, so we'll talk a bit more about the screening. So, in other words, just saying, much as it's a very common infection, few women will progress to develop the cancer. Even if they progress, it will take about 10 years or so before the cancer becomes established.
Yeah.
So you're emphasizing the importance of screening early.
Yes.
In that age. Is that why they recommend screening in young women, Dr. Days?
They recommend we screen women from the age of 21.
By 21?
Yes.
Okay.
Regardless of their sexual debut.
Okay.
So every 3 years from the age of 21, we recommend women to be screened for this HPV.
For HPV and cervical cancer. Yeah. Are there some signs and symptoms one can tell that they have cervical cancer?
Early stages of cancer of the cervix is asymptomatic. So most women will not present until much later. We said 80% of the women who we see currently with issues of cervical cancer come when it's too late.
When it's in a late stage.
Yes.
So the early stages of this cancer,
they are symptomatic.
They have no problems.
They are symptomatic. Not that they don't have problems. They might have some problems like maybe pain or irregular bleeding, but it won't be enough for, unfortunately, for them to seek medical help. They might think it is not a big issue.
Okay.
So
but the symptoms are not so common in the early stage of the disease.
No, they're not.
They become more predominant in the late stages.
Yes.
So which are some of these symptoms? Which
they
one should
vary.
Be aware of?
They vary. Most of the most common one I have seen is they present with bleeding. Okay, either while they wash themselves, or after sex, they tend to bleed. It's called contact bleeding, and it's one of the most common things that we have seen. There's also pain during sex. Okay. There's a discharge. Sometimes these women come with a very foul-smelling discharge. You can tell from.
It is not the discharge of. There are these sexually transmitted diseases like syphilis or gonorrhea. They also cause discharges.
Okay, I don't think
it almost similar?
No.
It's a pungent smell.
Yes, you would know.
It's a repellent.
Yeah, and it's strong.
A very strong discharge.
And it's not like, you see, with the STDs, it's normally very little. With this one, it's sort of like water.
It's a big amount of discharge.
Yes, a large amount of discharge.
So bleeding, you mentioned contact bleeding.
Yes.
Pain during intercourse, and this discharge.
Yes.
Are these the only signs that are available?
No, there are many, but again, like we said, it depends on the severity. There can be also infertility. There can be issues with the kidneys. In later stages of cancer of the cervix, there can be swelling, strokes. Okay. It depends on.
So, Dr. Mukesh, help us understand how does cervical cancer cause kidney problems?
How does it affect the kidneys?
Yeah, it's located in, these are two different organ systems, but it's surprising that a cancer in the cervix would cause kidney failure. How on earth does that happen?
So the uniqueness with the description of a cancer is like it metastasizes, it grows way beyond the confinement we actually want it to be. And that's the symptoms, as she's alluding to, later set in because of that. So it starts on the cervix, and we hope we can pick it up as early as possible while it is still on the cervix. A little later, it tends to grow all the way and fill the space in the pelvic, because the pelvic area is a small confinement. Any additional masses affects anything in there. So, two ways the kidneys might be affected. One, those masses could get to compress on the bladder and the tubes that bring urine from the kidneys to the bladder for you to urinate. So in the long run, that mass effect allows urine to compile up, and not the urine comes from the kidneys. So you don't void per se, but it piles up and sort of suffocates the kidneys.
And blocks the kidneys. Okay.
The other way is they metastasize. They move. The cells will move in blood and attack every other body part that you have in later, very advanced stages of this illness.
Okay. So they can also cause injury to the kidneys themselves, and the cells make their way up to the kidney. Send in your questions and feedback to our social media platforms, and stay tuned.
You are watching the DocTalk Show.